Welcome back to Healthline. I'm Dr. Kevin Soden. Today we're talking about cosmetic surgery for older adults. If you're considering plastic surgery, one of the most important decisions you'll be facing is choosing the right surgeon. It's crucial to your safety and the success of your cosmetic surgery that the surgeon you choose has the right qualifications. Joining me again is Dr. George Bitar, plastic surgeon, and registered nurse Pat Bonine. Thanks to both of you for joining us today.
Thanks, Kevin.
Thank you.
Tell me now, lots of people advertise that they do cosmetic surgery, but why is it important to go to someone who's trained in plastic and cosmetic surgery?
Well, Kevin, for the obvious reason that you want someone who's qualified doing your surgery. And there are a lot of doctors out there who say they're board certified, but they're not board certified plastic surgeons. And what I tell my patients is you should choose someone who's board certified by the American Board of Plastic Surgery, which is the only board of plastic surgery that is acknowledged by the American Medical Association. There are a lot of other names that are similar to it, but they don't have the same rigid criteria for selecting a plastic surgeon to be a member of this society.
Pat, you probably get lots of questions from patients about surgeons and everything. What do you advise people?
Well, talk to other people who've had plastic surgery. That's one of the best ways to find a good plastic surgeon. We have a lot of information on the internet about our practice, so that is a way of finding a good plastic surgeon. Do
you find women have certain expectations about surgeons, that they're looking for one particular thing, or do you kind of help guide them in a certain direction?
A lot of women come in having their minds made up about what they want. Some of them come in and say, well, I just want to look better. And then we kind of narrow it down to what don't you like about yourself and go on from there.
And Dr. Bitar, what kind of questions do you want patients to be asking when they go looking for a doctor?
Number one, I tell them ask for if a surgeon is board certified. Number two, ask if you can talk to patients who had that same procedure by that same doctor and talk to those patients. Number three, see before and after pictures and make sure that your expectations are realistic. Number four, ask where that surgery is performed. A doctor can achieve a good safety profile in an ambulatory facility. However, I stress to the patients that doctor should have hospital privileges to perform the same operation in a hospital that he does or she does in their own medical suite.
Now, Pat, you see patients before surgery. What kind of counseling do you do to them about their expectations or what they're going to go through prior to surgery?
Well, we start off going through the procedure. I give them the procedure in very great detail. Then I also go through the risks that Dr. Bitar goes through later. I show them the photographs. And then we go through, I spend a lot of time on post-op recovery, on what their expectations are to make sure that there are no surprises post-operatively, that they really can't get up and go to work the next day, that there is a recovery period involved, and that their results depend upon their nutrition and their ability to follow the instructions that we give them for their post-op care.
I hate to say this about men, but we tend not to ask as many questions and we keep things to ourselves as much. But do you handle men and women differently when it comes to plastic surgery?
I give the same detail to men and women. And I may go into a little more detail about the recovery for men to emphasize a little bit more the necessity for allowing your body to heal.
Dr. Bitar, do you ever turn away people? Are there certain people that you say, this surgery is just not going to work for you? You have unreal expectations here.
I would say we turn away about maybe 20 to 25% of patients who come to us, either because their expectations are unrealistic, as you mentioned, or their health will not allow a cosmetic surgery. I have performed general surgery before being a plastic surgeon, and I had a much lower threshold to operate on someone for medical necessity than for cosmetic purposes. And every surgeon should be that way. In other words, you should turn away people who the surgery may put them at risk. Thirdly, I think you have to turn away people who you feel that no matter how good the surgery is, it's not going to meet their expectations. And so those are some of the criteria. And fourthly, quite frankly, if I feel that there's a barrier of communication. If I tell the patient something, I don't feel that they are either understanding it or they're agreeing with it, or my staff tells me that that person does not feel that they are going to be a good candidate. I listen to my staff as well, and my nurse, Pat, and we make sometimes an office decision whether I should operate on someone or not. But for the most part, people who come and know what they want and are reasonable people will do well.
It seems like because this is an elective procedure and people don't have to go through this, that the trust and communication with the doctor who's going to be doing this is really essential.
Kevin, the one thing that I do emphasize with patients on their very first visit is that the most important thing about choosing a plastic surgeon is that trusting rapport with your surgeon. And if you don't have that with Dr. Bitar and I, then maybe you need to find another doctor.
These reality shows have become a big hit recently. What we call it, Nip and Tuck or The Swanner. You see all these shows. Do you think they create unreal expectations for our viewers out there, for people in general?
I think that it's a double-edged sword. I think that education is always important. In other words, to educate someone that there is the availability of plastic surgery. For example, I've had women in their 50s who've lived all their life with huge breasts that did not even know that an operation such as breast reduction exists. So shows like that can educate the public. The bad part of shows like that is it can set unrealistic expectations. When someone goes and has 13 operations and have a personal trainer and have a dietitian and are on a show and they're expected to perform in a superhuman way in a period of 10 weeks, they are going to have different results than the average 60-year-old woman who wants to have a facelift or a tummy tuck or things like that.
Dr. Bitar, I saw in the Wall Street Journal and a couple of TV shows you talked about people going overseas to countries like India and other places to get plastic surgery done, and regular surgery, even heart bypass surgery, a lot cheaper.
I think it's a very bad idea, but maybe I'm speaking from a biased perspective. I feel that in America we have some of the best medicine in the world, and to bargain on a house or bargain on a car I think is okay, but bargaining on your health and taking a chance, flying half around the world to have a surgeon operate on you that you don't know anything about them except that their website says they're good, to me sounds foolish. The second thing that I disagree with is having someone operate on you who's not going to be taking care of you in the post-operative period. I feel that the surgeon who operates on you should be the one taking care of you afterwards, especially with some surgeries that the first week or two you're not going to see the final result, as in cosmetic surgery. And you'd want to go back to that doctor and let them see you and take care of you for months and years to come, and that's not possible with a bargain shopping person who goes to India or Thailand or places like that to have cosmetic surgery. I'm not saying that they cannot have a good surgery, but you're taking your chances with the most dear thing to you, which is your body.
Dr. Bitar, Pat, thanks for joining us. We'll tell you where you go for more information about choosing a plastic surgeon at the end of our show. So please, stay tuned.